Good morning. It's Friday again. I hope you were able to catch Greg over on Show Me St. Louis earlier with Dana Dean. If you missed out on it, we will have that link coming up here a little bit later today as well. And he shared a twist on guacamole. He calls it guacamole. It's actually a guacamole with chicken in it, but he talked about our chips that we also offer at Symbol as well. So if you missed out on that, don't worry. We're going to be able to share that link with you later in the day as well. Introducing myself, I am Becky Schoenig, one of the co-owners of Symbol. We're a healthy lifestyle-focused restaurant. We're located in Kirkwood and in Chesterfield. Find Your Inner Flavor is a podcast that we bring to you so that you can explore, understand what it is that makes you tick, what gets you excited, and what you need for you to get you to the healthiest and happiest you that you possibly can be. I'm going to take a quick moment before we have this conversation with Dr. Anthony. I want to take a moment and I want to thank two people. These two people are actually sitting in the room with me today. You'll hear me talking about my two Lacey's. I've got Lacey with an I and Lacey with a Y. My good Lacey, my bad Lacey, my blonde Lacey, my black-haired Lacey. They both go hand in hand. They are the system behind this podcast that makes it possible for me to be able to do everything that it is that I do and still show up on Fridays doing these interviews. So I want to take that moment and thank them because they're here and they're holding little baby Jonathan as well. So we get to have a meeting after this. So welcome, Anthony. How are you?
I'm great. How are you, Becky? Also, thank you, Lacey's. Lacey with an I is the reason that we got connected in the first place.
It is. It's been, you and I you wanted to come work for me. And I said, hell no, you're not coming to work for me. What do you want to do? And here we are today.
That's a whole other story. Let's talk about your poop.
Yeah, let's talk about, I know you were, it was taking a little bit for your computer and I text message. This is Anthony and my relationship. One, I've interviewed him several times, so we know we feel comfortable talking together on camera. Two, he was running late or his computer wasn't logging in quickly and I sent him a message and I said, where are you at, shithead? So here we are. Now we're going to talk about my poop. So before we start, I have given Anthony 100% permission to talk about me specifically in this arena. So we are going to talk about me and why we went down this path. And if it's relatable to you, why it may be something you consider for yourself as well. So let's dive in, Anthony. Let's talk. You start.
Me start. I was actually hoping you could just start with, essentially just recapping the first conversation that we had with, what are your health goals?
Yeah.
And then I'll fill in some gaps with my thinking, but I think from you.
That's a good one. So I came in to see you, I guess it was maybe a year ago now. I don't know if it's been quite that long.
Like September, October, something like that.
Okay. And I think it was the combination of all of the stress that we had been under with the businesses. I had gotten into some really bad eating habits for quite some time. Due to the show, I wasn't focused on anything. I was like, I don't have any dietary issues. I don't have any problems. I don't have reactions to anything. So I'm completely healthy. However, I was starting to have some stomach issues that were starting to come back that were triggered, that felt familiar to what I had had in my 20s. And when I was in my 20s, my stomach pains had gotten so severe that I had gone into the emergency room a couple of times. They were wanting to test me for possibly Crohn's. And I was able to reverse a lot of those things, but I took my mental health under control. And that's why I was starting to change it. And then I had everything go undercover. And I think that as I've been getting older and not being really good with a lot of things, some things were starting to get triggered. So I came to see you. And you wanted to do all of this work, but it wasn't a lot. I mean, I came to you and I was very honest. I said, this is what I do. I still eat my chips I eat chips at night. These are some of the worst things that I do. I eat chips almost every single night. I do drink alcohol, but these are I'm whiskey, bourbon, tequila, not like mixed drinks. I do miss beer. I'm not going to lie. I do miss beer, but I'm working on that.
Yep.
So I was just kind of like, there wasn't a reason why I was avoiding anything necessarily. So I came to see you.
I'll fill in some of those gaps because I'll kind of tell you what my side of that conversation was. One of the things you didn't mention was kind of like just fatigue in general,
Yes,
which is a super, super non-specific symptom. There's a lot of different things that can cause fatigue. So really, there were two places that I wanted to start with you. Number one, which is really just like a vital sign, as important as your blood pressure or your heart rate, is a comprehensive blood panel. And not just the blood panel that you get at your annual physical, or you even go to a thyroid specialist. We look much more in depth at a bunch of different markers. The test that you ran initially through blood has about 75 or 80 different markers on it, not most of which, but maybe a third of which have never been tested in your life. And I would like to dive into some of those findings because that's pretty interesting. But certainly when you talk about your history of depression, and of course, any kind of gut issues, the very first place that I want to look is at a stool test. Doesn't take a genius to figure out, hey, if you've had digestive symptoms, you should probably look at a stool test. Now, similar to the blood work, it's not your standard stool test. So if you went into the hospital and said, hey, I've got acute diarrhea, I just got back from a camping trip where I was out of the country, they might test you for like 7 to 10 well-known pathogens and looking for an acute infection. So those are included in your stool panel, but there's much more that we look at as well. Specific to the brain, there is this concept called the gut-brain axis, where essentially stuff that's going on in your gut will directly affect your brain for most people, but there's some genetic variation there. So we can talk more about that a little bit in the future, but that's kind of where my mindset was just from hearing your basic setup presentation. I was like, well, we got to look at blood, we got to look at stool. By the way, since I have full permission, there's more testing that I do want to do with you, and you're due for some follow-up.
I know we're going to talk about that today. I know you do, and we will. So and I want to make this clear, because a lot of people go, well, they don't take insurance. All of these components come into play. Wellness Connections does do a payment plan, which made it very easy and simple for me to not feel like I was forking out a whole lot of money up front, made it to where it was a manageable process. The lab work was $145. That covered everything. So a lot of times people are thinking that if my insurance doesn't cover it, it's going to cost hundreds of dollars. And this is you took a lot more than what most people would do. Can
I jump in on that just real quick? Because the cost is especially for blood work, I think that's a really interesting point that most people need to know about. Those tests that we order, let's just run a hypothetical alternate scenario. Let's say you went to your doctor and said, I want these tests that are on this list. They'd say, okay, we'll bill insurance. The insurance company has to decide if it's medically necessary or not. So one single test, just as an example, homocysteine on your test, if that gets denied for medical necessity, you, the patient, would get a bill for, I don't know, James Maskell said it at that event, I think it's like $1,400 or something like that. Our cash rate that we negotiate with the lab is $20 for that single test. So essentially this
whole other subject in itself, and how this whole system. Yeah.
So it really is an incredible value. If you actually went to the lab and paid the rate for all of those testing that we do, it would be about $2,500 or something like that. So when you're looking at 145, it's like, that's just a steal. So, the insurance argument is really kind of null and void, but I digress. That's just
so let's dive into the fecal test. What did you find? What were we? Like, what does my shit tell you?
You found all kinds of shit in your shit. So I'm actually just looking through your report right now because it's been a while since I've looked at it. We didn't find any of what I call the usual suspects, like salmonella or E. coli or any of these like food poisoning type things. So that's great. We did find that your normal bacteria, what we just call our probiotics, our good normal residents of our intestines, you actually had too much of that. which can be a problem. Like a lot of things, and I do want to dive into iron in your case, too much can be a problem, too little can be a problem. So you need to have just the right amount. So you had too much good bacteria, maybe from all the kombucha that you drink or whatever, but that's a possibility. And then we did find some potential infectious bacteria, not like ones that like E. coli is a great example where you get, a food recall warning for lettuce or whatever, but bacteria that can be a problem if they overgrow. So you had some potentially infectious bacteria. In particular, there was 3 bacteria in your case that can potentially trigger autoimmunity. So I still have kind of in the back of my mind a thought that in your case there's some hidden autoimmunity going on. And that's where gluten is really important, and we'll get to that in a moment. But there are certain bacteria that if you get infected and they get overgrown can trigger autoimmunity if you have a genetic susceptibility. And if you eliminate those bacteria, you can actually reverse or at least put into remission an autoimmune condition. So that was pretty interesting for you. You definitely showed up positive. We really kind of hit a home run for a gluten antibody in your case. We did have a whole discussion previously on gluten, which I would refer people to look back at. But if your gluten test was negative, I still would have said that does not mean you're intolerant to gluten. The fact that yours was positive, we really don't have to do any further testing.
I just believe you discriminate gluten, period. Like what?
Say that again. Discriminate against gluten.
I think you just discriminate against gluten. Like what did gluten ever do to you to make you think?
That's a great question. I have this conversation a lot with patients where, if we test them for a food sensitivity and they show positive to eggs or beef or almonds or whatever, those aren't forever foods. Gluten is its own weird little category, especially when you have brain symptoms. And I think you're exactly the patient that we were talking about before we knew that in your case, where I said, hey, there's 3 places that gluten can attack. Mostly your gut, of course, your skin, and then actually there's 4, your thyroid and your pancreas, like your hormone system. And then the biggest, scariest one is your brain. So some people eat gluten and have no other symptoms other than brain-based things. And you actually told me at one point, just in a conversation, hey, I had some gluten, and you said a very interesting term, something like I had like self-sabotage thoughts and like just immediate like weird depressive symptoms. It's like, well, my stomach didn't hurt, I didn't have diarrhea, but if you eliminate that food for a while and you test it again and it shows up, it's like, hey, that's better than a blood test. That's better than a stool test. Of course, we identified that was that from the stool test, but you eliminate it and you test it again, you have weird reactions. That's diagnostic of a gluten intolerance. That's why it's forever.
I'm going to pause you for a minute because I'm going to backtrack a little bit more and dive into my story so that people kind of get an idea of where I was and kind of where I was borderline and where I am today.
Right.
So in my 20s, I was diagnosed with depression and bipolar. I was hospitalized a couple of times. I definitely was not the person that I am today. I was put on several medications that caused me to gain 40, 50 pounds in a couple of months. I felt like a zombie. And I was the one that started tracking my emotions and where I was at, and started identifying that it was hormonal because it was always coming the same week of the month. And talked to my psychiatrist back then and said, hey, I don't want to go back on these medications. I had found a natural supplement and wanted to start, and I was seeing results taking that. And I said, I want to go down a more natural route. And this is in my 20s, mind you. And my doctor said, I got a letter in the mail within a week saying that they were refusing to treat me any longer. So here I am, depressed. If you have been in these moments where you feel completely lost, and the system in that arena is another craziness when you're super depressed and you're seeking help, and it takes months for you to get in to see somebody. So I knew back in my 20s, I had the hormone issues. I knew that depression, bipolar, I was able to go, I've been off of medications for a very, very long time in that arena. So I was able to manage everything very well, but I was slipping into some areas of when you combine the stress from the business and when you combine the not caring anymore about what you were eating, that's when I was starting to see, and I'm in my 40s. So I was starting to see many of these symptoms starting to come up, and that's the lack of energy. And I'm questioning, yes, people constantly are saying, as you get older, you're not going to have the energy that you had when you were younger. And I don't think that has to be true. Even though I'm in my 40s, I am not old. Would you agree with me, Anthony?
Absolutely.
I'm like, please just agree with me.
No, you're in the prime of your life, and certainly your thyroid is a component to that, which we can talk about too. But I think you hit on something real important here. We're kind of in an interesting era where it's almost like it's bad to shame depression. People are coming out about how, oh, you need to get medicated, you need to get help for this, but really we're missing the boat on that, because usually there's an underlying root cause for some kind of depression or, anxiety or something like that. And a lot of times it's your gut or your thyroid or your immune system. So I think that's a good avenue to say, hey, there are other options. I'm not saying we should ignore that and it should be a stigma, but we need to realize that we're kind of looking in the wrong area when we look at just neurotransmitter theory and stuff. I would definitely encourage you and everybody who's interested in that subject to look into Kelly Brogan's website. She's an MD psychiatrist in New York, and she has a very interesting perspective on depression, and her entire practice model is built around getting people off of psychiatric medications and improving the root cause of that.
So it has become, I'm going to say this, and then we can go more into kind of the protocol, what you have done with me. So since you told me, I said to you, when you said, Becky, you have celiac, you really cannot ever eat gluten again. I looked at you and I said, no, that's not true. It is a choice for me to have anytime I want to, because for me, the mindset cannot be, you can never do this. And I think that oftentimes as a patient, when we hear that, we go into this fear mode and this lack mode, and our mind plays these tricks on us, and then we become so over-consumed by that thought, and it can sometimes be paralyzing, or you feel like the victim with it. And I had to approach it of, I am not going to be the victim in this. This is a choice I can make at any time that I want to, and have freely, I've made that choice a couple of times where I've been like, okay, but it's been an experiment for me. I had to become more aware of my feelings, my emotions. And like I said, I started having, it was those little sabotage moments. Now I call it biscuit brain, because
I like that.
I call it biscuit brain because I was in Nashville and had a biscuit. I was avoiding everything, and then I was like, oh, I'm going to try this. And then it was literally like 2 days later, yes, I was having the triggers. But what I'm saying is that the longer and longer and longer that I've gone without it, it's became much, much easier to make the choice of, no, I'm not. I think gluten or any food allergies or anything like this is no different than alcoholism or smoking or whatever. There has to be this process that you give yourself permission to say, okay, I went 1 week, or I went 2 weeks and then I did this, or I went 3 weeks. I went months and then sabotaged, and then I got, but the choice of saying no to it is becoming so much easier for me. The more I identify with who I am, how I feel, and identify, okay, this is what's going to happen. And do I have time in my schedule? Do I really want to go there? Because I can tell you, and I haven't seen you in a long time, and it might bring me to a little bit of tears. I am honestly in probably the happiest place I have ever been.
That's so cool.
I have my energy back. I feel good about myself. My mind is clear and I can think. And you helped move me on this journey, and I trusted you, and I could talk to you in relatable ways that would work for me. But it's been my job to figure out how to do this for myself and feel successful. So
you couldn't have said it any better. I would like to just elaborate on that, because I think it's where healthcare needs to move toward. Gone are the days, hopefully, of the doctor telling you what to do and, you know, smoking a cigarette and then walking out of the room. We're here to guide you, and really you're the hero of this story. You know, you did this work, you made these decisions for yourself, you've owned that, and really healthcare should be a partnership, it should be a journey, it should be a conversation, it should not be a dictatorship. So I really applaud you for kind of coming to recognize that and realize that, because you have to own your own health. You know, I can't be there every day, all the time, hovering over your shoulder, but you probably think of me every time you eat gluten. So that's, you know, you have to come to the point where you really can tell that affects you that way.
Right.
I'm really glad to hear. That's great.
Yeah, and I know you want me to do these follow-up tests, but you had been so clear that I had to go. So, like, you cannot have any gluten whatsoever for X amount of time. And then I went to Nashville and I ate a biscuit. Oh, and there goes Greg with baby Jonathan.
I can't tell you how many times I hear patients that say, you know, I was strictly gluten-free for X amount of time. Just one brief anecdote on that. A patient of mine, she knows who she is if she's listening, was basically very strictly gluten-free and had a hamburger bun, just like, oh, it's not going to be a big deal. And then the next day had like a full-on panic anxiety attack over having to do laundry. And she's like, what the hell is going on? This is not me. And traced it back. I was like, gluten inflames my brain. You know, it just does this. And most patients, when we get to that point, you know, I don't typically tell people up front forever, but since we have this relationship and, you know that from our discussion, I say, hey, give it some time. Give it a period of time. Usually I'll say 3 months, you know, that's doable for most people. And then I don't really say test it back in, but invariably people do. 80% of the time people say, holy crap, I felt terrible, you know, digestive symptoms, fatigue, I got puffy, my, you know, my brain stopped working, you name it, all kinds of weird, crazy symptoms. So I don't make this stuff up. I don't hate gluten. I just see what it does to people, you know, and the research shows us how those connections are made. So that's why it really is in its own category, separate from things like even other grains, you know, corn or beef or eggs or other highly allergenic foods. It's insidious. I don't know what it is about it.
You're kind of cutting out a little bit, and I don't know if it's your Wi-Fi connection or not. But let's dive into let's go into some of the other things that you had me do to kind of get to where it is that I am, like my iron.
Sure.
How did we approach that?
Iron is probably my very favorite topic. I was actually going to suggest we do a whole conversation about that, but it showed up in your case, so that's really cool. You are not iron deficient, which is most people think of, having low iron or anemia, very common in women, especially premenopausal women. So just slightly less common than that is iron overload, too much iron. And there's a lot of causes for that, but ultimately that's a problem. It doesn't really necessarily give you symptoms unless it's really, really elevated, and then that can cause things like heart disease and diabetes and stuff like that. But if we look at the difference between optimal ranges and like what the lab considers abnormal, your iron levels were about 2 to 3 times higher than they should be. So it's super basic. We take blood. I mean, we don't, but the Red Cross does. So we sent you to the Red Cross. They hook you up to a bag, and then they drain blood out. And that really just lowers your overall iron level. I find that a lot of times the most common symptom that people have from high iron, I am that patient as well. My iron levels are typically about where yours are. You just kind of feel fatigued, just not quite fully at your optimal energy when your iron is high. Similar to if you're low iron, you know, that's the most common symptom of low iron, is just being super tired all the time. So
yeah, and that I noticed almost immediately. I went in, I had my blood drawn. I was fairly lethargic for the rest of that day. But then the next day it was like I had more energy again. So you had me do that for several months in a row, where they would draw the blood and then they eliminate that blood. They can't use that for any purpose whatsoever.
Right.
But it was for me. So it was very helpful and beneficial. And then you had me do a line of supplements for about, I want to say it was 60 days. And I was not, and I had said that to you at the very beginning, I'm not very good at taking supplements. And then we had a bunch of them. And then I had fallen off the wagon right about the holidays. But you said to me, we got enough of it in you. I think we're totally good. There's no reason. So you were really,
Can I tell you a secret?
Huh?
Can I tell you a secret?
What?
I told you 60 days because I knew you were only going to do it for a month. I only wanted you to do it for a month.
Remember that shithead comment that I made earlier? Well, that's good on your part then.
There's a certain amount of psychology and, human connection research that has to go into, getting people to do behavior change. So I got you pegged.
Well, kudos to you on that. But then I came back to see you this last time. You wanted me on, you put me on the thyroid medicine and the B supplement.
Yeah, your thyroid hormones were not at an optimal level. You weren't technically hypothyroid or low functioning thyroid, but they weren't quite at the best level they could be. And that can be because of any number of things. Your thyroid's kind of like the canary in the coal mine. It's one of the first things in your system that will stop working optimally if everything in your environment isn't great. So we just kind of gave it a little bit of support with some stuff that helps thyroid metabolism. And I think you said you felt awesome on that stuff, which a lot of people do need it.
Yeah. And then you added the B for me. And I think the B wound up being a game changer for me.
Yeah. That's hugely important for your brain as well. It's kind of a hot topic now, methylation and MTHFR, who you've talked with Emily Hecker about on this program before. But B vitamins are pretty important for a lot of functions. So especially when we just look at energy, that's what most people think of when you think of B12. It's it's in your 5-hour energy stuff that you get a huge B12 shot. But that was a big piece of your puzzle for sure.
And I take it every single day. It is one of those things that I am like, because I recognize how it is helping me, and I recognize the benefits of the choices and how it is, it's much easier when you can be aware that it really does work. This isn't a placebo effect or anything like that. I mean, I really have noticed the difference when I've put all of these pieces together.
That's awesome. There's one last piece of your puzzle that I think is super important, and it's very common in many people, is inflammation. So we found about 3 or 4 separate markers on both your blood and your stool for inflammation. And on the stool, we found that your gut was inflamed. So if you have an inflamed gut, you're going to be not feeling great, period. So that can be from the infection, that can be from the gluten, that can be from stress and sleep. It can be from nutrient deficiencies. I mean, all kinds of stuff. But inflammation is hugely important if we look at, just a theme in your case, for sure. That's, so a lot of people are inflamed.
So let's go ahead and wrap this up. You tell me, I know that you want me to take this next test. Tell me what this next test is going to wind up telling us. And then we'll do a follow-up interview when that winds up happening.
Yeah. I was hoping we'd have it done before today, but that's all right.
I know.
It ensures I get to do another one of these.
Just get brain, remember?
I think really, the next thing I wanted you to do is just repeat the blood work, just so we can check in on a few of those areas. But if we look at the next layer of testing for you, it's the stress system, your adrenal gland, your cortisol pattern. We also look at your sex hormones, estrogens and testosterones. That test is super valuable. It's called the Dutch test, DUTCH. I would encourage anybody watching to just look that up. You just Google Dutch test and it'll pop right up. But it's a super comprehensive test that tells us about what's your stress picture. And you've said that probably 5 times so far in this discussion. So I think that's still a very important layer for you to unpack.
Well, I feel amazing right now. And you don't know this either, I worked out twice this week.
Look at you.
I know, because I kept saying, that's been one of my biggest, I know. It's been one of my biggest weaknesses, and I kept saying, I just don't have the energy to go do it. And I feel like that, now I feel like I have the energy to go do it. So I've added that in. So we'll see where I'm at here in a few months. I'm really going to be a superhero.
That's really cool. Just so people know, we didn't really explicitly say it, but you've had 3 appointments total with me since September, and we did 2 tests. And really, that's as simple as it can be. Some people come into this thinking, oh my gosh, it's going to be thousands of dollars and huge time commitment and all that. But really, if we start asking the right smart questions, you really can get some huge improvement right away. So
it really is, and the truth is that the money winds up being so worth it when you get your health back, and and you find the right partnership. So let's go ahead. We'll wrap this up. I'm just going to close this out. Is there anything else that you wanted to add, Anthony, before I close it out?
No, check out our website, thewellnessconnection.com. We just launched a podcast recently. One of our most recent episodes is actually about gluten with Dr. Olivia Joseph. That one's pretty cool if you're interested in that. We've got a lot of content there, and we're certainly open to help anybody who is, suffering with anything like you were, or just want an overall evaluation of your health from a different perspective.
Awesome. And can you add those links or anything like that in the comments so it's really easy and accessible for people?
Will do.
Perfect. So I'm going to go ahead and wrap this up. I hope that what you gained out of this is that it is important for you to find the doctor-patient relationship that works best for you. This isn't about a doctor that is going to stand there and tell you what you have to do. It's a partnership and a relationship that has to be built and gained. They're there to guide you. It's up to you to do the work afterward. There is no magic pill to making this all fixed overnight. But I am proof, and I am telling you that when you put the time and the effort in and you focus on that, it can help and it will change. And your life is so worth it. So my story has more to do with the mental side, the depression, the anxiety, the stress. I didn't have the gut issues. I wasn't running to the bathroom when I had gluten. So if you're suffering from anxiety, depression, bipolar, if you have a friend or a family member, eliminate gluten for just a few weeks. See what happens with it. And seek out possibly a functional medicine doctor or a health coach out there. A couple of podcasts for you to go back into our archives is like Dr. Emily Hecker, which Dr. Anthony had mentioned on MTHFR, or Dr. Anthony's previous interview that I did with him on gut health. Symbol is here. We're offering these resources. We talk about all of this education. Watch these doctors, see who they are, seek them out, and find the one that you feel is best fitted for you. I'm going to go ahead and wrap this up. I'm Becky, one of the co-owners of Symbol. We're a healthy lifestyle focused restaurant located in both Kirkwood and in Chesterfield, Missouri. I'm going to add a couple of links into these comments. We've got a health coaching component that we are implementing with Emily, or I'm sorry, not Emily. Had Emily on my mind just a second ago. Amanda LaPlante, and she's going to be doing that at our Kirkwood location on Tuesday evenings. And I don't remember who my podcast is for next week, but tune in next Friday, and we will see you then. Thank you.
Thanks, Becky.
Thank you.